There was a time when silence was considered a medical victory, when the absence of agitation, of distress, of visible chaos was enough to call a treatment successful. No screaming meant improvement. No resistance meant recovery. And, for a brief moment in the 20th century, that belief shaped one of the most infamous procedures in medical history. The lobotomy didn't begin as cruelty, it began as desperation. In the early 1900s, psychiatric hospitals were overcrowded, understaffed, and overwhelmed by patients with severe depression, schizophrenia, and psychosis. There were no effective medications, therapy was limited. Families were watching loved ones disappear behind locked doors with little hope of return. So, when a Portuguese neurologist named António Egas Moniz proposed that mental illness might be eased by cutting connections in the frontal lobes, the idea landed in fertile ground. His early reports suggested calmer patients, fewer delusions, less distress. It sounded like progress. The Nobel Committee thought so too. But the procedure that would define lobotomy in the public imagination didn't happen in an operating room. It happened in offices, hospitals, even makeshift clinics. Walter Freeman, an American neurologist with no surgical training, believed psychiatry needed something fast, cheap, and scalable. His solution was the transorbital lobotomy. A slender steel instrument resembling an ice pick was inserted above the eye, tapped through the thin orbital bone, and swept side to side to sever frontal connections. No neurosurgeon, no operating theater, sometimes no anesthesia beyond a brief electroshock to render the patient unconscious. Freeman traveled the country performing and promoting the procedure, convinced he was liberating people from mental prisons. And sometimes patients did become quieter, more manageable. But what often followed was not healing, it was flattening. Motivation vanished, personalities dulled, emotional range collapsed. People survived, but something essential was gone. Families described loved ones who returned home technically alive, yet profoundly altered. By the late 1940s, tens of thousands of lobotomies had been performed. And then, almost as quickly as the practice rose, it fell. New psychiatric medications emerged. Long-term outcomes were harder to ignore. Public scrutiny grew. What had once been framed as a miracle cure was re-examined as a warning, about unchecked authority, about redefining suffering as inconvenience, about how easily medicine can confuse control with care. Lobotomy didn't end because it was obvious villainy. It ended because confidence outpaced understanding, because good intentions were never matched by humility, and because silence, it turns out, is not the same thing as health. If you're drawn to the parts of history we tend to smooth over, the experiments, the failures, the uncomfortable in-betweens, subscribe to Vivarium, like the video, and stay with the channel. There's a lot more beneath the surface.